Hello, my name is Amber Bruce Hart. I am a graduate student at Lamar University, and I am in class MSNC 5311 Nursing Research. The title of my prospectus is The Reduction of Medication Errors by Implementation of No Interruption Interventions. Abstract. The aim of this study would be to potentially prove that the implementation of no interruption interventions will decrease the number of medication errors experienced on a medical surgical unit. Patient safety is a very important concept that is always on the forefront of healthcare. By decreasing medication safety, there could be a reduction in cost, mortality, and morbidity. The purpose of my study will be to examine the effects of non-interruption interventions on the amount of medication errors experienced on a medical surgical unit. No interruption interventions can be defined as a set of interventions put into place to decrease the amount of interruptions experienced by a nurse during medication administration. No interruption interventions includes, but is not limited to, defined no interruption zones, such as a place in the medication room where if a nurse is present, there are to be no interruptions. Signs placed that are visible indicating that the nurse is in a no interruption zone and should not be disturbed. Visible signs worn by the nurse, such as a bright-colored pin or vest. Enforcement of teamwork that includes nurses, ward clerks, and other personnel on the unit, helping nurses to troubleshoot other issues involving other patients while the nurse is providing medication. And also nurse education on ways to avoid interruptions and distractions while giving medications and the risks that patients face when a nurse is interrupted. A medication error is defined as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. According to studies, approximately $177.4 billion was spent to compensate for medication errors, resulting in injuries in 2000. According to the United States Food and Drug Administration, FDA, medication errors are responsible for an estimated 1.3 million injuries annually and 1 death daily in the United States. This study would be based on the theoretical framework of the high reliability theory. This theory was chosen due to the emphasis that it placed on patient safety. Results of my literature review included influences of medication safety. Some of those influences included therapeutic relationships between the patient and the nurse, ward design, and deviation from best practices. All three of these things influence the level of medication safety on an individual unit. Also, there was literature on no interruption zones. Another aspect of my literature review included five-part intervention, which included using yellow tape to mark off medication areas as a quiet zone, placing 2 do not interrupt signs on the wall in the area, using a prepared medication protocol checklist as a reminder of the correct method to administer medications, instructing other personnel working in the same area to not interrupt the nurse, but using teamwork to field phone calls and other distractions and interruptions during the medication administration cycle, and nurses wearing a fluorescent sash when they begin to retrieve and administer medications to all assigned patients during the scheduled time. My literature review also resulted on some information on drug round tabards, which are the fluorescent vests used to signify that the nurse is doing medication administration. These are some of the references used in this PowerPoint, and this concludes my presentation. Thank you very much.